So a lot of questions nowadays in medical school, dental school interviews, they tend to be scenario based. So for example, rather than saying to you, well, what are your views on abortion? Interviewers are more likely to give you scenarios. And it's through scenarios that you need to then talk about these relevant issues. However, they want to see that you are comprehensive in the way you think. So this is how I think we need to think about it when it comes to dealing with scenarios. They want to see that you can deploy judgment that's balanced and fair with good reasoning. They want to see that you're empathetic, thoroughly empathetic in all these situations. You want to display excellent communication skills and professionalism. So how are we going to do that? Well, what we are going to do is we are not going to jump to conclusions. So I see this sometimes where my students, when the question says, what do you think? What should be done? They quickly give judgments. They quickly give a decision. The problem with that is often you've done that very quickly without thinking broadly, without being comprehensive, without looking at pros and cons, without considering important issues like ethics, without displaying empathy, and you've just very quickly zoned in to what you think is right or what you think should be done. And that mutes the complexity and the richness of what would otherwise be a great answer. So how do we do it? When you hear that question, that scenario from your interviewer, I would advise you to do the first thing, which is summarize. Summarize in your own words what you've heard, what you understand by the question. That allows two things to happen. Number one, a mental hook in here that you will address. And the evidence base shows that when you create these mental hooks, you tend to answer it better rather than diving in straight away. Secondly, if you verbally summarize that scenario, that question, it allows your interviewer to check that you understand the question, that you've got the right context, and it also allows them to correct you if needs be. And they'll do that for free. It's not negative marking in these interviews, so it's a good thing to do. It only takes a few seconds to do as well. So don't forget summarizing. The next thing to do is think about identifying. So identifying key issues, key ethical considerations, key practical issues. So there may be, you might find, there's a major thing going on around ethics here, i.e. justice or autonomy issue. There's a key thing going on around the big C's, i.e. capacity issue or consent issue. There's a big thing going on here about safeguarding, for example. So what are key issues? What my excellent students end up doing also, and that's because I teach them, is also bring some context to it, i.e. you might have read about it. So the question's about, let's say, a patient wanting strong painkillers to help end their life. So here the context would be, besides ethics of autonomy here, justice here, besides looking at capacity, consent issues, besides looking at safeguarding issues, you also want to talk about potentially what's hot at the moment, which is, let's say, the assisted dying bill in Parliament, right? So what's clear and contextual out there? There's practical issues to think about as well, which is communication issues between you and the patient, between you and colleagues potentially, between you and carers potentially. So what are the communication channels here? Is there any time pressures? Is it an acute situation where you don't have much time to think, you need to act quick? For example, it's an A&E emergency scenario. Is it a place where you can make decisions, where you're not stuck for time and you're able to give yourself a bit more time, or buy yourself some time? Is there any patient safety issues like I mentioned, safeguarding issues, child protection issues? Are there any teamwork issues here? For example, you need to involve somebody senior, you need to go somewhere for advice, Or here, is there any lack of information because it's an acute scenario where the patient can't communicate with you, or there's a dementia case, or somebody can't say too much to you because there's severe mental health issues, or learning needs issues going on? So how do we then progress this further? So this is where the next stage comes in, is basically looking at the hooks, a few hooks, you explore. So these hooks, if you like, where you explore, you might want to look at things from a patient perspective. What are the key issues here? You might want to look at you or colleagues' perspective. What are the key issues around you that you need to think about? What are the key issues around, say, organization, i.e. your surgery or the hospital or the country as a whole or public health? What are the key issues here around, say, legislation that you need to think about, around rules and protocols? Remember, I've also mentioned in my previous videos around ethics. Ethics for me is an evergreen hook, is a golden hook. It always has to be considered when it comes to looking at pros and cons and important things. There's always something to talk about around ethics. But don't just say ethically. Don't just say all of the pillars. No, don't just rattle them off. Think about which pillars are the important ones here. Depending on the scenario, you might find its autonomy. You might find its autonomy and non-maleficence. You might just talk about justice, for example, because that's the relevant pillar. So it's about relevant amplification of certain pillars from ethics. Having done all that, then you might go to the last phase, which is recommendation. What would you recommend in this scenario? And what you'll discover soon is that often it's not about saying, I agree or I disagree. Often it's more like saying, well, if A, B, and C were to be the case, I might do this. If C, D, and E was to be the case, I might go that way. So recommendations or opinions, sometimes you have to sit on the fence and say, well, I might do this and this. Or if conditions were like this and that, I'd do this and this. So you see, it's about showing maturity and complexity in your answers.